got lots of people joining us, and I'm really grateful. Sandie, before I introduce you, I just want to say something about aging. So, I'm 56, and I often get told, oh, you're very lucky, you're genetically blessed. So I wanted to show a picture of my gorgeous father. Okay, so this is my father, and he aged beautifully. He unfortunately passed away at 82 with cancer, but he aged beautifully. At 60, he was absolutely gorgeous with no sagging. And this is my even more beautiful mother. Okay, and is absolutely gorgeous, but I could see her aging trajectory was a little different, and she started sagging a lot in her lower face and wrinkling in her skin. She had very, very thin skin, and I didn't know genetically which way I was going to go, whether I was going to go and age like my dad and get protected that way, or age like my mom. I really had no idea. I entered skincare, quite late in life at the age of 40. So that's quite late, only 16 years ago. And I went through a lot of a hit and miss kind of, slapping on the latest trendiest stuff on my skin, then having a reaction to it, thinking, oh my God, I went through two phases, that the more expensive I went, the better it would be. Or then I went cheaper because I was believing the marketing hype over the science. And so it was a very, very long journey for me to get to where I am, these 16 years. And so what I want to tell everybody who's joined is that, yeah, you can be genetically blessed. And I was, and I am genetically blessed, but also habits and epigenetics, or your lifestyle, can really impact your aging. And this is where Sandie comes in. So I'm going to ask Sandie a question. Can you introduce yourself, Sandie, and tell us a little bit about what you do?
Yes, of course. And thank you to everyone for joining us so late as well. So my name is Sandie Fredrickson. I'm a health and longevity coach. I'm also a weight loss expert for women over 40, and I trained as a nutritional chef. So you might be wondering, what on earth is a health coach or a longevity coach? Is it some kind of doctor? Is it like a nutritionist? So health coaching is a new-ish concept in the UK, but I trained in the US where it's very commonplace. But it's been catching on over here in the last few years. When I discovered it, it just made total sense to me. It was like a light bulb moment. And what drew me to that is that I recognize that we only tend to seek help and support with our health when something goes wrong. So instead of doing that, I was interested in how to tool up ahead of time to try and avoid the things that can happen. In my case, I got breast cancer 10 years ago when I was just 44, and that was the life shock that woke me up to needing to prioritize myself and my health. But it also left me asking, why did I wait so long? Why did it take hitting rock bottom for me to start thinking about how I was living? So helping my clients really have a plan for the second half of their life, to have a roadmap for avoiding disease where we can. That is really where I wanted to position myself. And through my training and my education, I started to latch on to this idea that the smallest of habit changes can really make a big difference to our health and our health trajectory. It doesn't have to be like some big overwhelming project. I like to describe it as when you're flying a plane. If you change the course by just 1 or 2 degrees, you'll eventually end up in a completely different destination. So working on your habits is the strategy that I like to focus on with my clients today, and where this kind of moniker of the Healthy Habits Coach on Instagram came from. And Sabrina, I know we worked together a couple of years ago and you really embraced the whole process. I remember you came to me with 10 different diet styles under your belt, and you said that none of them stuck. So we worked on your diet first, and then we worked on sleep and stress, and gut health was a particular one. And now we worked on how you were moving your body because you were very stuck in the clinic. And now you're resistance training 3 times a week. So there's been so much change. So is it fair to say that a lot of the habits that we worked on together now perhaps feel like they're more on autopilot for you?
Yeah, a lot of them are autopilot. So let me just rewind a little bit. So interestingly, when I was in college, which is too long ago to remember, I did do a nutrition course, and I have always had a very antioxidant rich diet. However, I am a sugar junkie. I'm a couch potato, and I'm a complete stress puppy. So I need to control everything. And, like, because of the work I do, it's this perfection thing that completely drives me. And all of that, as we know, accelerates aging. So sugar accelerates aging. Stress shortens your DNA telomere, accelerates aging. And obviously, salt and, can also do that. High salt. Luckily, I was never, into salty food, but my poison is sugar. And also because I was inherently a couch potato and I prioritized work over movement, because there are only that many hours in the day, and I am a workaholic. So I put myself last in terms of maintaining my health. Now, like you, when you had your health scare, I actually I discovered both my kidneys were scarred, when 21 years ago. And that did put a fright up, a rocket up my backside. And I went through a real change, and I got very, very fit, very healthy. And, and then again, obviously life happens and you slip. So the problem is that every time you slip, you sort of detour. And I went off piste for a very long time. And I think that when I hit that rock bottom again and you came into my life, I was so ready to take on a mentor and a coach. And the things that really stuck with me are the 10,000 steps. That's non-negotiable for me. I go out in the rain, in the sun, and I walk my 10,000 steps. So movement has become part of what I do. You have really instilled in me the need to do strength training. So now I have a fantastic bunch that you introduced me to that I strength train with 3 times a week. And, I have inherently made dietary choices that allow me to be healthier, although I still haven't kicked the sugar habit. So, I've become fitter, and my skin and my gut has improved because of the choices I've made. And therefore my skin health has improved. So, definitely, I think just changing the course of your trajectory a little bit can make a huge impact. And I think working with you as my coach was phenomenal in that. But let's bring it back to a little bit about genetic testing. Okay. And why skin health genetic testing? And, can you sort of share your thoughts and your experience with genetic testing?
So I'm a huge fan of genetic testing for overall health, for skin. Who doesn't want to lift the lid and look inside at their genes and see what they have in store for us as we age? It's a remarkable thing that we can now do. Very simply, how it works is we all have, well, some of our genes will be normal, the majority of them will be normal, but some of them will have a variation. And the ones with a variation are the ones that we're really interested in. That is where we can personalize medicine and personalize a treatment plan for skin. So I like to describe it as being handed your operating manual for your body and your unique body. And when it comes to skin and how your skin will age, you may, for example, have a certain variation that will put you in the camp of a faster breakdown of collagen compared to the next person. And that's really valuable data to have. And the sooner you have it, the better, actually, because there's so many effective things that you can do to combat it if you get started early. Technology in the clinic, supplements, lifestyle changes. So the DNA skin test for skin specifically, genetic testing will shortcut you to a unique set of recommendations for your personal data set. No more trial and error, no more trying out the latest creams that you described. And one important thing to say as well about genetic testing of any kind is that you are born with your genetic system, your blueprint. It's not going to change. So once you've done that test, you're not going to need to do it again. That's it. Your unique set of data is in your hands.
Yeah, completely. So I did my genetic testing overall for longevity because, my dad had 2 cancers. There's a huge cancer risk on my paternal side of the family. And it threw up some very interesting things for me that I needed to be careful about. But the most important thing about my skin test was that I was predisposed to this increased collagen breakdown. Was predisposed to sagging and wrinkling. But hey, I was not predisposed to acne, and I was predisposed to very sensitive skin. Everything that gradually in my journey I had discovered, but I wasn't paying particular attention to right at the beginning, by just slapping on all kinds of things on my skin. And so for me, it that I need to do this every year to 18 months, because this is how I'm predisposed. I'm pre-programmed to age this way. And so for me, I understand that my skin health is about maintaining the thickness of my skin, improving the texture of my skin, and then using the technologies that I have in my clinic based on the genetic code that has predisposed me to aging in a particular way, in addition to the lifestyle factors that are accelerating aging. And then I've been able to combine that along with the Visya skin analysis. So we've taken away sort of just looking at your skin and saying, your skin looks great, and not being able to see under the naked eye what's going on. So we have cameras, we have, we can see what's happening with your pores, with your wrinkles, with your brown pigment, with the UV damage you have, with the sensitivity. Monitor your progress. So, people think that they buy one type of skincare and then that's it for their face, and we're going to be able to monitor you and tell you, right, okay, this is working really well. Now you need this for maintenance, or, and then you need this for your treatment plan, which is to improve, whatever particular genetic predisposition your skin has of aging. And so I'm really excited that to have you on board and to be offering something that is not only scientifically sound, it is the future. And, it's the future, and it's a very evidence-based, futuristic way of managing skin rather than just going on trends and marketing rubbish. It's actually looking at it in 360. Can I just ask you that in terms of the gut health axis, and I, just touched upon it, tell me why you're such a big proponent of the inside job for healthy, glowing skin?
Yeah, I love this idea that beauty is an inside job, because our body is such an interconnected system. There's an undeniable link between how we look and our internal health. You've mentioned that today. And it's not just the obvious things like how we hydrate or our diet. As you mentioned, it's like the gut, your gut health. And there's many things you can do about to help to support that. And this gut skin axis is a very new idea and something that we want to bring to the clinic. But cortisol levels, how you're sleeping, how stressed you are, your exercise habits, and even things like your emotional state are going to wear on your internal health and show up in your skin. So one of the other things that I love that's aligned with this beauty from the inside out idea is that the report that you'll get with DNA Skin will talk to you about supplements. And there's so many on the market, gummies now, adverts for this, that, and the other, which I'm sure, some of them do a really good job, but how do you know that they're going to work for your unique set of data? So a genetic test or genetic skin test is going to give you that information, and then the team at Perfect Skin Studio are going to lay out exactly what brand and what dose of supplement to take. We're not going to leave you guessing. The report will tell us what you need, and then you'll be told about the brand and the dosage. So no more guesswork, no more trial and error.
This is what I love, okay, because basically it's, let me explain what the package is. So we call it the Perfect 360, for the skin. Perfect 360 is a concept that I created in 2016 and trademarked it. Conceptually, I've always believed in looking at energy-based treatments, injectables, and surgery, and combining everything holistically. And of course, now we've taken this a step further by this inside-outside approach. So it is truly a Perfect 360. So essentially what happens is, if you sign up, you have a skin DNA test. We do the skin DNA test for you in clinic. It's just a tiny little pinprick test. and the results take anywhere from 2 to 4 weeks to come back. But on the same day, we do a skin visia analysis for you, and we also do standardized imaging for you. And then we assess your skin, and you get a little gift box of just some trial products to start with. So very, very few products to start with. Then you can have either 2 facials. So we have to decide between them. And that's what I want to talk about. So one of them is the 3D Miracle, which is the world's first cold ablative laser. And it's suitable for any skin type. And so this is if you have textural issues on your skin, so fine lines, wrinkles, etc., then it's just like a lunchtime chemical laser, a laser peel treatment, couple of days downtime, and then your skin glows and you get back the radiance. So part of the package is you can choose 3 3D Miracle laser facials, or you can have the endomology lymphatic drainage facial. Now, this is phenomenal because a lot of my patients are worried about downtime. Because there is a little downtime with a 3D Miracle. It's negligible, but there is still a downtime. With the endomology facial, which is a lymphatic drainage and facial toning facial, you get a radiance, and the science behind it is incredible. So, you get almost an 87% reduction in fine lines and wrinkles. There's an 80% increase in your hyaluronic acid, and 70% of people after the first treatment felt their skin was firmer. Now, let me tell you where I see this sitting in. It's phenomenal for patients who have very stressful lifestyles. We all drink alcohol. Smokers, they have very dull skin. Their lymphatic drainage is affected. But here's a news flash. Even if you're having fillers can be associated with a sluggish lymphatic system. So when you have this lymphatic drainage, which is a 30-minute facial, your skin automatically glows. Now, I've just got off a 14-hour flight from Seoul on Sunday night. So I went to Seoul for 3.5 days for my Seoul niece's wedding. And I had the facial before I left, and I had the facial when I came back, just to get my skin back in condition. And there is no downtime with it. It's a 30-minute facial, and it has incredible results. So as part of this package, the Perfect 360 package, not only do you get your DNA test, you get a skin visia analysis, you get a little goodie box with starter skincare, and you get a course of lymphatic drainage facials, or you get a course of the 3D Miracle. And then guess what? This is where you come in. They get a fantastic session with you. So Sandie, tell us about your 90-minute health coaching session. What does that sort of...
Yeah. So why did we want to include this? So you and I have been talking for a while about the importance of matching the desire to control how you age on the outside, how you look, with having a plan for how you're aging on the inside. And it's a really progressive step, I think, to bring into an aesthetic clinic. So we're really excited to be incorporating this in this package. It's the first thing that we're doing. And I'll give you a little bit of an idea for what that 90 minutes would look like. It's over Zoom, so I want to make it as convenient as possible. And it's really an opportunity for you to bring all topics to the table that you are concerned with, feeling challenged with, or even just curious about. For some, it may be sleep or low mood, low energy. And for others, it could be, why can't I lose weight as I'm getting older? Why is it just not easy anymore? So you bring all of that to the table. We'll go through whatever topics really important to you. And my job as a coach is to make sure you walk away with feeling better informed, with specific resources and 4 or 5 action steps to get you moving forward, which is the whole point of coaching. And then I want to also keep some time, which is why we're making it 90 minutes, to talk about how putting you in control of how you feel today is important, but also how can we maximize your future health? What can we do to cut your risk of disease? Things like muscle mass. Why is muscle the organ of longevity, and why is ignoring it such a big mistake as you age? Bone density, why you should be measuring it, how do you measure it, how often should you measure it? unlike muscle, you can't rebuild bone density when you lose it, and we're all losing it from the age of 30. So this is a really important one to focus on early on. Gut health, simple ways to support that. We've already referred to the gut skin axis. Why managing stress and sleep might be more important as you age than managing diet. That's a really unusual one for people to sort of take on board. So that's why we've made it 90 minutes. Really, you know, bring a cup of tea, have a proper chat, take notes, and walk away with actionable steps. I really want to spend time on giving you a roadmap for how to get in control of the coming decades.
And I can't tell you how amazing it is, because it's such a safe space to be talking to you. And, you know, people always tell me, like, why did you take on a coach? And I said, well, you know, top level athletes don't just go and play at Wimbledon, or they don't just, they don't just drive in F1. They actually get coached. And so even for high performance individuals like me, you need a coach. And I think sometimes just getting into the right headspace is so important. And I think a lot of the things you said to me have made such a big difference and a big impact in just my everyday habits. So I can understand why you're called Healthy Habits. So let me finish off what the package involves. So they get this 90-minute session with you. Then approximately at 4 weeks, the skin DNA results arrive. And then they get a formal consultation with one of the doctors in my team, who goes through their DNA test result with them, advises them on supplementation, on what supplements they should be taking. And so you get a really, you know, multiple page printed out report that you can go home and read through. But it actually now starts telling you, okay, listen, this is how you're predisposed to aging. You've already had some lifestyle changes recommended to you by Sandie. You know, this is going to slow down and slowly, you know, reverse the trajectory of how you're aging, how your skin is aging. And then they get recommended treatments based on how they are predisposed to age. So we start using science. We use the skin vizier. We use the quality of their skin. We look at their genetic testing. We give them supplementation. And then we talk about this plethora of all these wonderful energy-based devices and fillers and biostimulators and polynucleotides, and hold your breath. Autologous, that means your own exosome. So we take your blood and we spin it down. So it's not PRP, because PRP is going to be part of what we're offering in January, but exosomes, which are your messenger cells, which accelerate hair growth, which accelerate skin recovery. These will be your own. They are not marine. They are not other humans, but they are your own autologous exosomes. So we have a lot of exciting stuff that the doctors will advise you, and we'll, you know, custom fit and personalize something that uses all this amazing technology. So that incorporates diet, lifestyle, supplements, and the treatments to give you a complete personalized Perfect 360 treatment plan. And I know we've just got 4 minutes left. So I just want to say that we have an offer on. Ordinarily this, and this is for the new year, this is coming for 2024, so that you are fit and well for 2024, but you can pre-book all these treatments, because we start when we reopen in January, because we shut next week. And everybody who's listening to this, we offer this at a £300 discount. So you would get this whole package at 1,500. So it is us looking after you for a good 3-month period with these lymphatic facials, or with the ultra clear 3D miracle, with the skin vizier, with the skin DNA test, with the consultation and the advice. But of course, the supplements are extra and the additional treatments are extra. Do you want to add something to this?
No, I think I'm really excited to be adding the wellness coaching into the clinic and the package as you've described, because I think for some of us, you can go and see a doctor and get some advice, and you go home and you carry on with your life and you forget what it is you're supposed to be doing. Life takes over. And also a lot of us know what we should be doing and we're just not doing it, right? So to have someone support you, to hold your hand through it, to hold you accountable to doing the things, I think is what can really make the difference. So I think the combination of wellness, beauty from inside out, the scientific side of things, evidence-based, it's all very exciting. And yeah, we look forward to seeing some of you in the clinic.
Yeah, I'm really looking forward to it. So remember that you want to call up the clinic and you want to quote Instagram, just say Instagram with Dr. Sabrina and Sandie, and we will give you this. Of course, it's a limited time offer. So we want people to book in the run up to Christmas, and the course will start. You just have to pay a small fee, a deposit for booking it, and then it's only when the course actually starts that you pay the full amount, but you get a £300 discount, and there are lots of goodies, and you get to see me and Sandie in person along with my team. And I can't recommend these treatments enough. And certainly you can see my skin. I know I have the ring light on, but you know, you guys see me all the time in clinic, and you can see how my radiance is back, just looking after my gut skin health, keeping my movement going, and having these lymphatic drainage treatments and good scientific topical skincare.
I'm going to come in and do one of those facials. Absolutely.
You have to come in. You have to come in this week. You're going to glow for Christmas.
Yes.
Anyway, so thank you everybody for joining us. This is going to be recorded. And if you have any questions, we'll do a follow-up one for you. Sandie and I are very excited about this, and I'm excited to be offering this new treatment.
Yeah.
But that's it for now. Have a fabulous Christmas. Thanks, Sandie.
Bye.
Good night, everybody. Bye-bye.